Well, good afternoon, Justin. It's good to see you.
Yeah, absolutely. Good to be here. Thanks for having me.
Yeah, and this is Justin Cheeseman with Dreyer Physical Therapy out of Bluffton. He's the clinical director there, and I'm Ron Williams with Exit Realty out of Hilton Head. And so, Justin, tell us a little bit about yourself and where you're from and that kind of thing.
Sure. Like Ron said, Justin, originally from New Jersey, been down here in the Low Country for 4.5 years. My wife and we also have a beautiful daughter as well, who had moved down here and just up in New Jersey, had a few clinics on my own with another guy, and came down here just kind of slow life down a little bit. Been with Dreyer now for 4.5 years in our Bluffton location. A couple different roles there, from center manager for a bit, now more in just kind of a clinical support role and just kind of mentoring the staff a little bit. But it's been great. It's been incredible.
Good, yeah. And I mean, Dreyer's a great name down here. I know they're in with the schools and other places, so they've done a lot of good things for the people here in this community, I know for sure. I mean, the reason we're talking today is obviously we're in a new world of how you guys have to treat people and social distancing and all this stuff with the coronavirus, COVID-19 going on. So tell us a little bit about the changes you guys have made and what you're doing to, accommodate social distancing and stay-at-home orders.
Sure. Yeah. So, with us as a medical practice, physical therapy, we were deemed essential by the state and the federal government. So we still are open per usual. We have maybe changed our hours slightly just to accommodate some of those folks. However, we are now offering a telehealth option as well, which is kind of neat. I've had the ability to do a few of those calls, and what it is those folks who don't necessarily want to venture out, whether it's due to their illness or some other illness, whatever it may be, but they're still having pain. So we've seen it with former patients who maybe their pain has returned. They've been more active, they've been less active, whatever it might be. And then we've also seen some folks that'll just kind of reach out, whether it's to myself or one of our other clinicians, and say, hey, the other day I was in the yard, my knee's been bothering me. So we have the ability now to have that face-to-face conversation, kind of assess what they have going on, and give them some tidbits of advice, whether it's modifying some activities, whether it's some exercises, whatever it may be, really from the comfort of their own home, which has been really great. And then we have the ability to follow up with them as well, and touch base. And if it's something where we think they need more care, we can obviously direct them and refer them in that way. But it's really a great way to help our community, as well as minimize anyone's risk having to go into a different medical facility where they may be exposed. And we don't want that for anyone. We're trying to keep our neighbors safe, but also assess and address their pain and their issue.
Yeah, and so I mean, I think that was what we were telling me about this. I thought it was kind of cool that people have that option, and you guys can do that and guide them through and hopefully bring some comfort to them at this time where people are probably panicking. How am I going to do these exercises and that kind of thing?
Okay.
And this is a question I'm just thinking of. I don't even know the answer, and maybe I shouldn't ask, but does insurance cover these things? Or
that's a great question. So currently, it's kind of it's an evolving situation, much like we've all seen, whether it's through news coverage or even through our own local governments. But currently, Blue Cross Blue Shield, a lot of the major payers are covering it. The one hangup that we have had thus far is that Medicare, as of today, is not covering it in the state of South Carolina. So that's really one of the payers who, obviously, in our community, we have a lot of retirees, a lot of folks that have chosen to retire to our beautiful island and our beautiful place. So we have had a struggle with that, but I would encourage anyone, even if they do have Medicare, and if they are worried about that cost, to if you're genuinely having pain and you genuinely think that something is wrong, still reach out to us. I mean, we're here to support our community. Our main goal is that. So we've done that as well. We've had some former patients who reached out and didn't want to come in, but know that it's not quite been covered yet through Medicare. And I mean, at the end of the day, I mean, we're people helping people. So we wouldn't let a financial piece or something as little as that prevent someone from seeking the care they need. So
yeah, well, I love that about you guys. You you're about caring about the community.
Absolutely.
Yeah, you got to make some money and get paid, but you're here to help people, and that's what it's about. And I know you guys are doing some struggling. You had to do some furloughing and some of those things to get people covered, but you're trying to stay open and trying to keep people going. So we appreciate that a lot. So that's good.
Absolutely.
People have been doing this. I've been asking. So tell me some stories about what you've been seeing in the community. People helping other people out and doing things. It's been kind of neat. But what have you seen?
I mean, for us, we've seen a few things. We've had some former patients that have dropped off some homemade masks to us, which is really cool. Obviously, when we do have those patients coming into the clinic, we want to make sure that we're protecting them as well as our staff at the end of the day, and just doing those basic things that we've been asked to do by the CDC and some other agencies to flatten that curve or whatever we can do to minimize that. And then we've just seen some folks in the area. We have patients that call in and we'll go and grab some groceries for them. I mean, the community outpour has just been incredible. I talked to a gentleman earlier, a local businessman who is doing the Help for Hope Found with the meal cards. And I mean, all you have to do is be in this community for a very short time and realize that it is just rich with fantastic people that all they need is something like this to jump on, and they're going to just take full opportunity to do that. It's been amazing. It's been incredible.
Yeah, it has. I would agree. It's been so fun to watch and see in this time of social distancing and whatever else. We as people always need each other, and to see people caring for each other, finding ways to make that happen has been great to see and great to happen. Full disclosure, you are one of our agents with Exit Realty. So there may be
I was waiting for that to crack the screen or something,
Yeah, right. But how are you seeing things in the real estate side of things?
I mean, obviously, it's minimized foot traffic. I mean, obviously, we're limiting people out and about, but I think it gives us an opportunity as real estate professionals to develop some of our processes and to look at what we're doing from whether it's a marketing perspective, whether it's reaching out to people that, past clients, it gives us a great opportunity to kind of invest in those people that have either utilized our services or that may need to in the future. And again, regardless of what profession it may be, we have an obligation to our community to serve it. So as agents, we, whether it's in a medical profession, which I have done for quite some time, or real estate, which has been probably the last 4 or 5 years or so, I think both those professions have an obligation to the community, and what a great opportunity.
Yeah, I agree. One last question for you. You're looking in a little better shape than I saw the first time we met. So you want to tell us a little bit about that?
Yeah. So I just over recently, it's actually, I was talking to Ryan earlier today about, we had a big couple of days, but my wife and I, we work with an organization over in South Africa, Life Community Services. And it's an organization that just does a tremendous amount of things over there, from educating, the children to educating the adults to make them sustainable in their lives, make them employable, self-sustained, self-reliant. So a good buddy of mine over there runs a ministry, and, he and I had kind of talked, and what my wife and I decided to do, she hadn't quite run yet, but she's been very supportive, is for every $100 that we were able to raise, I would run a 5K. So we're not quite sure if we just have very, very generous friends or people that we know, or they just enjoy watching me sweat and be, fairly fatigued after the 3 miles. But, we're about a week and a half into this, and we've almost met our goal, which is pretty amazing, and I've seen people that I grew up with. I had a gentleman today that contacted me that I went to school with 15 years ago in PT school. I haven't talked to since, other than the social media interactions. And he said, "Oh man, hey, I saw what you're doing here. I donated today." I mean, it's incredible. The generous spirit of human nature is just phenomenal. And it's been really, really cool to see. So it's been amazing.
It's fun to watch and see the journey, and watching you sweat and being a little bit of pain. Been fun. So you may need to be practicing on yourself here soon, right? Hopefully you're.
Yeah, I'm not shy on people that can help me out a little bit when I limp into the clinic. I have plenty of great folks there that can help me out. So
it's good. Well, Justin, I appreciate you taking the time today. And,
Absolutely.
Best of luck to you. Stay healthy, stay safe, and we'll talk to you soon.
Awesome, Ron. Thank you very much.
Yep. Take care.
Thanks, man.